Hey guys, this is Dr. Singh. I'm a cardiology fellow here at East Tennessee State University, and I love teaching medical students. The idea is to make it simple as possible. Today we are talking about tachyarrhythmias, and we will cover in 15-minute portions, see how much we can cover today in an hour. The idea is to cover the entire tachyarrhythmias in 1 hour. Hopefully we can do this. So I'll be covering some basics before we get started. That's your EKG. I'm pretty sure you're all familiar with EKG. The duration of EKG from this end to this end is 10 seconds. You all know this, right? So if you want to do a 60-second heart rate, just multiply this thing with 6 and you get the heart rate. At the bottom of every EKG, you have what we call standard calibration. So if you look at this EKG, it says 10 millimeter per millivolt, and it says 25 millimeter per second, right? So I'll be drawing some. What you should know on the EKG is you have a P wave, you have a PR interval, you have a QRS complex followed by T wave. That's every EKG. That's your heart, that's your SA node, that's your AV node, that's your His, that's your bundle, left bundle and the right bundle. That's how you conduct normally when you have an impulse causing depolarization starting in SA node. You have a right atrial depolarization, you have a left atrial depolarization, collectively making a P wave. When you have this conduction depolarizing both the atria, this is right atrium, this is left atrium. When it goes from both the atria and the AV node, we call it PR interval. PR interval. Again, PR segment is different from PR interval. PR interval is from starting of P to the starting of QRS. PR segment is end of P, beginning of QRS. That's PR segment. Then you have depolarization of the ventricles, which is starting from here till the end of here. We call it QRS. QRS. That's your T wave. And another interval you should know is repolarization starts from here till the end. We call it QT interval. Right? I'm pretty sure you guys already know this. Because the EKG speed is 25 millimeter per second, if you divide that, we have a big box on the EKG. I'm pretty sure you're all familiar with, right? These are all big boxes, which is further divided into 1, 2, 3, and 4. 1, 2, 3, and 4. From here to here, we call it x-axis is 200 milliseconds. So, because the paper speed is 25 millimeter per second, each box is 40 milliseconds. Each box is 1 millimeter on the x-axis and is 1 millimeter on the y-axis. So, it's 1 millimeter square. So, one big box on the x-axis is 200 milliseconds. On the y-axis is 5 millimeters. 1, 2, 3, 4, 5. Each box is 1 millimeter, so 5 boxes is 5 millimeter. If you combine 2 boxes like this, it becomes 10 millimeter. This is what we call 1 millivolt. This is the standard calibration you all should know. 2 boxes on the y-axis is 10 millimeters, is 1 millivolt. So one small box is what? Is 0.1 millivolts. You should know this when we talk about ST elevation. Another important concept, what is QRS duration? What is normal QRS duration? To understand tachyarrhythmias, you should know what is narrow and what is wide. Narrow is less than 120 milliseconds. Wide is more than 120 milliseconds, which is 3 boxes. And here is 3 boxes, wider than 3 boxes, right? Narrow QRS means less than 120. Wide QRS means more than 120 milliseconds or 3 boxes. Third important concept you should know is what is RP interval? What is RP interval? Normally, you have a P wave, you have QRS, T wave, followed by another P wave, QRS, T wave. This is R wave, that's another R wave, that's P wave. We are looking at the distance from this R till this P. And if you divide this RR interval into 2 equal segments, you have a 50% on this side and 50% on this side. If this P is falling beyond this 50% mark, we call it long RP. Again, we are measuring the distance from preceding R to the following P. This is called RP interval. It looks pretty simple if you have a patient who is in sinus rhythm. If this patient is having a tachyarrhythmia with a heart rate of 180 beats per minute or 190 beats per minute, it will be very difficult for you to find the P wave. But it's very important for classification purposes. You should know what RP interval is. If this is falling somewhere here, we call it short RP. Somewhere here, we call it short RP. If this is falling beyond in this segment, we call it long RP. Here you go. First 15 minutes, I'm going to spend just classifying tachyarrhythmias.